As Lisa mentioned, I am a registered, a registered social worker, and I worked in the field primarily long-term and community and home care for 25 years before I decided to take my career in a new direction and become a yoga teacher. And that came about because I was dealing with a very difficult situation. My mother was diagnosed with advanced cancer, and I was attempting to caregive for her when she lived 1,000 miles away. So the yoga that I started to do for my own self-care actually transformed my ability to cope with that situation and the grief. So I did my yoga teacher training, and now I specialize in yoga for grief, as well as yoga for pelvic wellness, because I came across a course for yoga for pelvic health, and I thought, that sounds really interesting, I'll take that. And it was through that course that I found that there was help available for my pelvic floor issues. And what a message of hope that was. And if nothing else, that's what I want to convey today, is that there is hope in dealing with these issues. Just because they're common doesn't mean that you have to live with it. There is help available through pelvic floor physiotherapy and yoga. You may be wondering what a trauma-sensitive approach to yoga is. And it is an approach that ensures that people feel safe and in control at all times of their yoga during their yoga practice. And that's important to me, that I practice in that way, working with people who have trauma. Even if you don't have trauma, it's a very comfortable and empowering way to practice yoga. And my goal is to help people find comfort and connection with their bodies to alleviate mental and physical distress. And I especially enjoy working with absolute beginners. My yoga business is called Yoga for the Rest of Us, because I myself had had a negative experience in a yoga class that had prevented me from wanting to do it for many years. I hurt myself as a child doing yoga. And I also didn't feel comfortable going to a public yoga studio, didn't feel like I fit the part or looked the part. So that is why I choose to, or enjoy working with absolute beginners. So just by way of introduction to our topic, the topic of pelvic health makes some people uncomfortable, and I am on a mission to help women better understand their pelvic floor and encourage conversation about it. And today I have the privilege of talking to this willing audience. So I'm going to throw out a few pop questions during my talk to see if we can challenge a few common myths. And hopefully you'll leave a little wiser about your pelvic floor and how to care for it. Too many women suffer with pelvic floor issues that can be both prevented and treated. And the consequences are huge. They range from social isolation, not going out, doing activities that you would normally enjoy, travel, playing with children or grandchildren, for example. Also having profound effects on intimate relationships and sexual functioning. So many women are not aware that there are alternatives to medications and surgery, which of course can have undesirable side effects. Males have pelvic floor issues too, but to a much lesser extent than females. And what I'll be talking today about primarily applies to females, though some of it will apply to men as well. I've provided you with a handout. If anyone doesn't have it, I have extra copies here. This is the best pelvic floor screening tool I've come across so far. And part 1 identifies risk factors for having pelvic floor health issues. And part 2 identifies issues that warrant an assessment by a pelvic floor physiotherapist. I wanted to start out with a really quick anatomy lesson. Okay, so this is a diagram of what's called the core 4. Okay, and these are the 4 muscles or muscle groups involved in the pelvic floor. So the pelvic floor actually extends from just below our ribs to our gluteal folds, so the folds in between our thighs and our buttocks. Okay, it's quite a large proportion of our body. At the top is the respiratory diaphragm, okay, that moves up and down when we breathe. At the bottom is the pelvic floor muscles, right in the pubic bone area. And around the front, sides, and back are the TVA, or the transverse abdominal muscles. And there are muscles that also extend or attach from the pelvic floor to the spine, and those are called the multifidus, or multifidi, plural. And the pelvic floor is made up of muscles, nerves, tendons, blood vessels, ligaments, as well as connective tissue. And it attaches at the coccyx, the tailbone at the back, the pubic bone at the front, and the sits bone. So those bony protrusions that we sit on, those are where it attaches at the sides. And has anyone heard of the pelvic floor described as a hammock? Yeah. Okay. A more accurate description is actually a trampoline, because it does move up and down. Okay, hammock suggests that it just kind of is a sling type muscle, but it's actually a trampoline. It moves up and down, and that movement is very important for correct functioning. So one of the jobs of our pelvic floor is continence. So that is holding in the contents of the bowel and the bladder when we want or when we need it to. The pelvic floor acts like a clamp on the openings to our bowel and bladder until we sit on the toilet, and then if the pelvic floor is functioning properly, it will relax to allow us to pee or poop. So if we're leaking at other times, that muscle is not, or those muscles are not doing their jobs well. So every muscle in our body needs to be able to completely relax and completely tighten at the right time, okay? And for example, we need the pelvic floor to relax to deliver a baby or for sexual intercourse. We need it to tighten when we cough, run, jump, sneeze, or laugh, okay? Okay, and if we think about a muscle being contracted all the time or tight all the time, just take the bicep as an example. You think about how you can flex your bicep, right? If we keep it flexed, it's not going to work well. It's not going to be strong, and it's going to get very tired. Okay, so that point is going to come up a little bit later. So I'll move on to talk about some common problems that can occur with the pelvic floor. And these problems, there is an increased risk pre and postpartum, as well as after menopause. Does anybody know why pelvic floor issues can become either worse or arise after menopause?
Less estrogen?
Yes, less estrogen. Okay, so estrogen is a hormone that keeps the muscles soft, supple, and stretchy. Okay, when the estrogen goes down, the muscles cannot maintain that as well. Okay, so the first of the common problems I'd like to talk about is pelvic pain. And this affects about 25% of women, and some of the common pelvic pain conditions include endometriosis, painful bladder syndrome, painful sex, and lower back pain. And you might be surprised to learn that a study was done at McMaster, this is fairly recent, within the last couple of years, that showed that women presenting at an orthopedic clinic for lower back pain, more than 95% of them had a pelvic floor issue. Okay, so remember how I talked about the multifidus, those muscles that go from the pelvic floor to the spine? Well, if that's too tight, there's going to be a lot of pulling, right? And the next problem, very common, incontinence. Okay, so leaking bladder. Anybody have any idea what the statistics say about the prevalence of incontinence?
Very high. I think it's huge.
Very high. It is very huge. And probably it's underreported, right? Because this is based on self-reports. So statistically, we know, or we believe, that 1 in 3 women suffers from incontinence. And there's 3 main types. The first is stress incontinence, and we're not talking about psychological stress. That plays a role, but I'll talk about that a bit later. We're talking about physical stress on the pelvic floor. So this is running, jumping, sneezing, coughing, or laughing, okay? And there's leakage when you do those things. There is urge incontinence, and this is what we refer to as key in the door syndrome. People are laughing, you recognize this, I know I do. You gotta go when you gotta go, okay? And it can also involve frequency, so needing to go pee a lot. So frequency is described as needing to urinate more than 8 times during the day or more than once at night. Okay? And there's a third type of incontinence. There's actually more than 3. These are the 3 most common, called mixed. And it means you have a combination of the 2. So you have a combination of the stress incontinence and the urge incontinence. There is another statistic that 50% of women will end their life wearing adult diapers. And this is very sad to me because this doesn't have to be. The third common problem is prolapse, and this is where the uterus, the bladder, or the rectum push the vaginal wall inside out. And what it feels like, or what it can feel like for a woman, is a sensation of heaviness, of bulging in the vagina, or discomfort. And about 60% of women at the age of 60 have a prolapse. It's also very common post-childbirth. Many women will not recognize that they have a prolapse after childbirth, and sometimes it will get better on its own. Okay, so there are common causes for pelvic floor issues. Maybe I'll just stop there for a moment and ask, because I know this can be a lot of information, and a lot of new information maybe. So I'll just pause and see, are there any questions? I can certainly let you know if there's a question that I'll answer later on. But I want to make sure there's time for your questions or comments. Okay, great. Okay, I'll just forge on. Okay. So the first most common cause of pelvic floor issues is too much tension. Okay? So the pelvic floor is the first muscle group to respond to a threat. And I find this fascinating, having studied psychology in the past. There was a very interesting study where they showed frightening films to women, and they measured the response of the pelvic floor and the response of their eyes. So an eye blink. You know, when you see something frightening, you blink. The pelvic floor responded quicker than the eye did. So that was fascinating to me. So of the 96% of women who had pelvic floor issues in that McMaster study I mentioned, 71% of these had too much tension in their pelvic floor. Okay? So this is also referred to as an overactive pelvic floor. And too much tension can cause pain, constipation, or incontinence.
Sorry, can you just describe what you mean by tension in the pelvic floor? Like physically?
Yeah,
Like,
it means the muscles are short and tight.
okay,
Okay?
okay.
So in other words, they need more, they need lengthening and they need stretching.
Okay.
Yeah. Okay. Does that help?
Yeah.
Okay. So time for our first true or false question. Women should do Kegels to strengthen their pelvic floor if they leak urine or want to improve their sexual functioning. Is that true or false? Women should do Kegels for good sexual functioning and to strengthen their pelvic floor.
I've been told that.
Wow, hearing all of these rumblings, we've been told, I've heard, okay, okay. This is
They can do Kegels, but it's
Yes.
not that they should, like it's the only.
perfect, yes, exactly. Women can do Kegels, it may help, but some women should not do them. And this was totally surprising to me, okay? This is a widely held belief among healthcare providers and on internet health sites. I've done some searching to see, and if you see, you know, problems with sexual functioning or incontinence, if you search that term, you get all this stuff on Kegels and how to do them. A couple of problems with this. Kegels can make things worse for some women. The other issue is that studies have shown that very few women are able to do a Kegel correctly, just with verbal instruction. Okay, so 2 problems with the Kegel recommendation. And as I mentioned, for women with too much tension, that's the majority of women with pelvic floor issues. Kegels can make things worse because those muscles need to be stretched okay? They need to be stretched first, and then they can be strengthened, but only if they're weak. Okay, they may not be weak. A woman can have too much tension in her pelvic floor, but it's strong. Okay, so that is a woman who should not do Kegels. And this is where the pelvic floor physiotherapist comes in, because she can assess what's going on in the pelvic floor. So is there too much tension? Are those muscles weak? She can also test whether the Kegel is being done correctly, if that's what she recommends. Okay? She can also recommend other appropriate exercises. And it also helps me in terms of doing yoga with a woman who's having pelvic floor issues to know exactly what the physiotherapist has said is the problem, and then I can recommend appropriate yoga for that condition. So are there any questions or comments about tension or Kegels? Is that new information?
Yeah.
Yeah.
So is it only a physiotherapist that could tell? Like, is there any other way to diagnose whether it's a tension problem or?
There are symptoms. There are symptoms, yeah. Yeah, so typically tension, you know, lower back pain, I mentioned that. Some of the other signs of tension could be constipation, okay?
So why would tension in the pelvic floor cause constipation?
Because everything's so tight, things can't pass. So you can even have like pain or difficulty with urination as well.
Okay.
So difficulty with bowel movements, painful intercourse as well. Everything's just too tight. The lower back pain, pelvic pain, so in other places as well. Those are some of the common symptoms of too much tension, yeah, as well as incontinence. Okay. Because if everything's too tight, then when there's any pressure on the pelvic floor, those fluids are looking for somewhere to go. So there's an opening and they'll go through there. And as I've mentioned, the muscles get very tired when they're tight all the time. So that can cause leakage as well. Okay, so true or false? It's usually a good idea to urinate before you leave the house.
True.
No hesitation there.
We tell our kids, so it must be true.
That's the point I wanted to make. So we're all going to get up on our feet if you can. Nobody's got their soup on their lap, so we're going to get up on our feet and just do a little thing. So we're going to lift our heels alternately. So we're going to leave our toes on the floor. Just lift our heels. It's nice. Okay. So maybe your mother told you to always go pee before you leave the house. Maybe that's what you tell yourself and or your children as well, because that was the right thing to do. And yes, by all means, if you don't know where or when you're going to have access to a toilet, do go before you leave. But the problem that happens is that when we consistently go pee when our bladder is not full, our brain gets conditioned to believe that our bladder is full when it's not. Okay? So, there are some strategies to help delay urination, because we actually have to recondition our brain to know what is a good capacity before we void, to kind of overcome that urgency, okay? So what we can do is we can distract ourselves. So you can distract yourself mentally, thinking about something else, doing something else. And it's good to practice this at home where you have a toilet nearby, you know, because it can cause some anxiety. Anxiety will make the urge worse. So deep breathing will help calm the nervous system, help you hold on a bit longer. You can even sit on a rolled up towel, pressing against your perineum to help with the sensation that you need to go. And just try that, stretching it out so you can go a little longer. This is called heel pumps. You can do this. Have any of you ever seen kids go, oh, I need to go? They do this intuitively, I think. There's actually a nerve in the back of our calf that mediates between the brain and the pelvic floor. Or the brain and the bladder, sorry. So we can actually interrupt that signal and buy ourselves some more time by doing heel pumps. It's great with the key in the door. You know, a key in the door, oh, you know. So there you go, and I'll sit down now. Alrighty, so, Good measure is aim for a urine stream of between 7 and 10 seconds. So that will tell you that your bladder's at a good capacity before going. Yeah, and there is no such thing as a tiny bladder. So okay, any questions about urgency or comments? Yeah.
So this conversation may give me the urge to go now.
Well, this goes to show, right? It's the brain has a big role in this. Yeah. Yeah, so even just talking about it, right? Yeah. You might notice too that there's certain things that kind of set you up for need to go. I know it's me, it's being out in the cold. Yeah. So,
Water running.
what is it?
Water running.
Water running, yes.
Yes.
Yeah. Mhm. Yeah. Okay. Other questions before we move on? Okay, great. So our next true or false question: psychological stress affects the functioning of our pelvic floor muscles and organs. I may have given this one away.
Yeah.
Is it true or false?
True.
It is true. Yes. Okay. So the third main cause of pelvic floor issues is a sensitive nervous system. So if there's pain or incontinence, stress will make it worse. And as I'd mentioned before, the pelvic floor is a kind of threat-o-meter, and stress can increase the tension, which then increases the symptoms. So switching the nervous system from fight or flight to rest and digest through breathing exercise, mindfulness, or relaxation is key. So the next question, true or false, the way you breathe is critical for a healthy pelvic floor. True. Yeah. Okay, so we're going to have another little demonstration. I think most people probably have room. So if you have the room, I'd invite you to take your hands and just place them on your lower ribs so your fingers are extending around the front and your thumbs are extending around the back. So, and we're just going to take some breaths here. So ideally, if you can, breathe in and out through your nose. And we're going to breathe in, and you're going to feel the front, sides, and back of your ribs expand. So you have to breathe fully into your lungs. And as you exhale, you're going to feel your hands come closer together. It's just a very subtle movement. But this type of rib cage breathing encourages us to move our diaphragms properly so that we're getting good coordination and functioning of the pelvic floor muscles. So this is called rib cage breathing. We can also imagine that there is an umbrella in our torso, and that umbrella is opening on the inhale as our hands move apart and closing on the exhale. So when we breathe like this, our respiratory diaphragm moves down on the inhale, pelvic floor diaphragm moves down, and as we, let me think about this. As we inhale, yes, they move down, and as we exhale, they both move up again. Yeah. Okay. So I have a few tips for helping, facilitating good breathing for your pelvic floor health. Avoid wearing tight clothes that constrict your breathing. So believe it or not, yoga pants can be a problem if they're too tight. Okay, and definitely, a lot of clothes are too tight. So if you're wearing something that's form-fitting, just see if you can do that rib cage breathing comfortably while you're wearing it to know that your pelvic floor is being helped. If you wear Spanx or anything else that's kind of holding you in, make sure you take them all the way down to your ankles when you're on the toilet. Okay? So, because if you've got something tight around here and you're on the toilet, there's going to be some tension in your pelvic floor, and we always want our pelvic floor relaxed when we're going to the toilet. We want to blow out on the exertion. So if we're lifting something heavy, for some women it's even getting in or out of their chair, or doing abs like crunches or sit-ups, we want to breathe out on the exertion. So I'll just show you what that looks like. So I'll pretend I'm lifting something up from the floor, bending my knees, of course, lifting it up. I'm going to go, okay? That helps protect your pelvic floor. Blowing out on the exertion. We want to be mindful of our posture so we can breathe fully. So I call it slouchasana, because we do asana in yoga. Slouchasana or slumpasana on the couch, watching Netflix, may not be helpful to your pelvic floor, okay? Especially for long periods, okay? Because you'll notice if you lean over this way, like if you can, just lean forward and try to breathe and see what that's like. Now, do you have the capacity that you did when you were sitting upright like this?
Against the hill.
That's right. Okay. Okay, so just an illustration of the importance of breathing. Any questions here? Yeah.
What about support stockings?
How far up do they go?
Well, they go to here. I mean, it would be hard to move.
Yeah, you know, I haven't had that question before and I'm not sure. Yeah, but if you want to leave me your email address, I have a pelvic health professionals group I participate in, and I could ask the question to see if anyone knows. Yeah, yeah, and that is an issue, right, getting things off, appliances or...
Because I put them on with rubber gloves, so I don't carry
Right, right, okay.
And I put them on lying down, and I wouldn't want to be lying down on a bathroom floor.
Yeah, and there may be some other tips to help you as well, like on the toilet. I've actually made a few little, I say little because they're short, Facebook live videos that I've put on my YouTube channel. I mean, one of the things I mentioned, I've got toilet tips for a happy pelvic floor. You want to make sure you're sitting down on the toilet. And I know it's like, ooh, public toilets. But you can always cover the seat. But that's really important. I mean, I used to pride myself on being able to hover. But that, you've got tension in your pelvic floor when you're hovering. So you need to relax. And you can also, when you're having a bowel movement, raise your feet up on yoga blocks or books or something. And that will help with bowel movement as well. So those are two things I can think of right off the bat for everyone, but you know, with the support stockings as well if you can't remove them. Okay, I have another true or false question. Pelvic floor physiotherapy is 80 to 90% effective in treating incontinence.
That would be nice.
Sorry, what's that?
Would be nice.
Yeah, okay, so people don't sound too sure. Someone said true. Okay, it is actually true. And this is a statistic from a study. And this is with 5 to 6 visits, okay? Pelvic floor physiotherapy is a fairly new specialty within the last, I think, 10 or 20 years. I think it's just 10 years. Unfortunately, Canada is not one of the countries that provides or funds pelvic floor physiotherapy pre and postpartum. In many countries, Australia, France, the UK, it's a given. Women receive it, it's paid for before and after they have children. And in the UK, in fact, a pelvic floor physiotherapist assessment is required before bladder surgery will be considered. Okay. So it's important. I mean, I didn't even know that it existed before I took my course, and now I know, and I can't say enough about the value of pelvic floor physiotherapy. And we have quite a few. We're fortunate in Kingston. We have quite a few pelvic floor physiotherapists, some of whom I know. So that's really valuable.
So how many people go that route versus being advised to have surgery?
I have no idea. I hate to think of it. I know a lot of women are prescribed medications for incontinence. And I have no idea if they're ever referred to a pelvic floor physiotherapist. I would hope so, but I know I was not referred for my issues that would come up at a physical, you know? It's like, oh, you're getting older, you're in perimenopause. And I just believed it. Like I suffered for more than 10 years with pelvic floor issues. Yeah, just talking it up to perimenopause.
Do you have a list of names?
I have a few people I refer to who I know personally. Yes, so I can send you that direction. Yeah. Did someone else have a question? I thought I saw it here. Oh, great. Okay. So the next question is, True or false, yoga can help with some of the pelvic floor conditions discussed today.
True, sure.
This is a trick question.
Become.
Yoga can help with all of the conditions, okay? Because yoga takes a whole body approach. Pelvic floor issues, remember, are usually caused by too much tension, weakness, or a sensitive nervous system. So yoga can help with all of these. Yoga can recommend effective breathing exercises for relaxation. Body awareness, so actually knowing what's going on in your body and being able to visualize that can be very effective. We do movements to relax and or strengthen the various muscles, as well as down-regulating the nervous system from stress to calm. And as Lisa mentioned in my introduction, I receive treatment for my pelvic floor issues, and I use yoga to maintain the benefits. Otherwise, my body would just go back. And so my problem was overactivity or too much tension in my pelvic floor, causing all kinds of issues for me. And I have to do the yoga. If I don't do it, it's like I'm going backwards. So it's been really empowering for me to be able to take that into my own hands, because I cannot be going back to the physiotherapist all the time. And yoga is now part of the specialized training for pelvic floor physiotherapists. So, are there any questions before we move into the conclusion? Yeah.
Could you explain a little bit about the difference in like the physiotherapy approach versus the yoga approach in terms of like exercises or how it might look different?
Yeah. Well, typically the physiotherapist, she'll do an intake assessment, right? Talk to you about what you're experiencing and narrow things down. And then usually she will do an internal exam, okay? Using one gloved finger. And that is how she can assess internally the muscles, what's happening inside, and then be able to tell you and then recommend. So some of the things she may recommend are very yoga-like. Different stretching exercises, different strengthening exercises. If Kegels are recommended, she would go over with you how to do them and how to do them correctly. I know for me, I received some guidance around posture, good posture. As I say that, I sit up straight. And some breathing as well. When it comes to yoga, so yoga is a combination of breathing exercises, right? So there is a whole range of breathing exercises we can do in yoga, and they all have different effects, okay? So for a lot of times in yoga, it's going to be breathing for relaxation response. And we also do a lot of movement, okay? So I can recommend poses that will isolate the effect. So I was just making a video recently with my favorite pelvic floor stretches, because I need to stretch. And there's things like moving your knees outwards so that you're actually stretching those muscles. Or if any of you know reclined pigeon, so you're like lying on your back, your leg is like this, okay? So you're getting the stretch. So sometimes the hips get very tight too, and there's a lot we can do with the hips in yoga as well. Yeah, so I'm not sure if that answers your question.
I think I understand the intake process, but I was thinking more like, what does the subsequent physiotherapy treatment look like? Is it just similar stretching as to yoga, or is there something?
Yeah, I know my physiotherapist, I probably saw her 5 or 6 times, and each time I came, like the initial assessment was a longer assessment, because I had the questionnaire and the exam, the internal exam. But then after that, each time I came, she would give me some different recommendations, different exercises for the handout, that kind of thing. But I found when I started taking my course, it just opened up a whole other world for me, because there were many other poses that I had never learned in my yoga teacher training that can be helpful. Yeah.
I don't think of a physiotherapist as doing an internal exam typically, so was this something that your GP could do to assess?
If they're trained,
Oh,
yes. Yeah,
so-
if they're trained to know what to look for,
Mhm.
how to assess the tension. Yeah, yeah.
Hmm.
Possibly, I don't know how many GPs are actually
Yeah.
comfortable doing that assessment. Yeah, yeah. And it is a specialization for pelvic floor physiotherapists. They need to have a special condition on their license. Not sure what you call it. It's not a rider, that's an insurance policy, but it's something on their license, and you can look up, I mean, I always recommend looking up your professional on their governing body website to make sure that they have the qualifications they need to be doing that type of treatment. Because typically physios only work on the outside of the body, not the inside. Yeah. So, great question.
Yeah, I had an experience after giving birth to my second child, that I felt some of these symptoms, the heaviness, more frequent urination, and I went to a physiotherapist specialized in pelvic floor. It was really uncomfortable experience, and I didn't, I don't know, it's hard to know what to expect throughout the visit, but the assessment was that there is nothing wrong, and what was recommended to do internal massages. And I'm like, okay. I don't think I want to come back.
No, and,
So-
and it's a bit alarming to me to hear that it was an uncomfortable experience, because a physiotherapist should not progress to the internal exam unless their client is completely comfortable with that.
And that was 7 years ago, so I'm not sure.
Yeah.
It was in Toronto, so I'm not sure how progressed.
I'm really sorry
Yeah.
you had that experience. Yeah, because if you're still having symptoms, you know, there is help. There is help available, and you do need to see the right person. Yeah. There have been times when women have come to me for yoga, and I've had to say to them, you know, I'll see you for yoga after you see a physiotherapist, because you're having so many different symptoms here. I'm not sure what we should be working on, and I certainly don't want to make things worse. Yeah. Yeah. And typically, you had your second child when the symptoms started to show.
Yeah. it was
Yes,
worse.
and
Yeah.
that's pretty common, actually.
Yeah.
It's often after the second child that.
Yeah, but reading more about it, I start to avoid, for example, lifting heavy weights or doing chaturangas at yoga, because that would put even more pressure.
Yes.
Where at times I thought it was helpful, so.
Yes,
Yeah.
yeah, so, yes, and something, I know it's written in here, I think I skipped over it, you know, these baby boot camp programs, we wanna be very careful, because it's really important that there's adequate time for recovery postpartum, because women do injure themselves. You know what, I've missed a whole section here, because I didn't talk about weakness. Can I just go back and talk about that? Okay, great. Okay, so the second main cause, okay, after tension is too much weakness in the pelvic floor, and downward pressure on the pelvic floor weakens the muscles that support the organs, okay? So they become stretched and weak. So sometimes this is due to pregnancy and childbirth, but it can also happen to women who have never had children. It can happen when there's a lot of coughing, so a respiratory condition can cause that downward pressure. Poor posture, heavy lifting, or straining to have a bowel movement. All of these things can cause weakness. And there's a lot to be done that can be done to prevent too much downward pressure in the pelvic floor, so managing constipation and respiratory conditions, lifting correctly, and improving posture. Has anybody heard of diastasis or diastasis recti? Okay. So this condition happens to about 1 in 3 women. And there's a connective tissue called the linea alba that runs between our navel and the pubic bone. And you can sometimes see it in women who are pregnant. It shows up as kind of like a purplish, a darkish line. So it's that separating, that's connecting, connective tissue in our six-pack, basically, area of our abs. And the diastasis occurs when that separates. Okay, so there's an opening that occurs there. So when there's too much downward pressure, it has to go somewhere. So if it goes down, that can be a prolapse, okay, where the rectum and bladder are pushing out in the vaginal wall. And if it goes out, if that downward pressure goes out, that diastasis can occur. This can also happen in men, particularly with obesity. That linea alba can separate. And it can also occur from physical activity. So some younger women have this if they are really strong athletes. Yeah, so they're doing a lot of ab work and such. They can develop the diastasis from that. Yeah, so thank you. I'm glad I could remember to come back to that.
How do hernias fit into all of this?
I'm not sure. Yeah, yeah. It sounds like it would be similar though, doesn't it?
Yeah.
With the pressure.
Because I also have a hernia.
Okay, and you're right. I mean, another great question. I need to write your questions down to ask my group. Yeah, because those happen, like they happen around the navel, right? An umbilical hernia, groin. So it's the pelvic floor.
Yeah.
Yeah, definitely. Okay. Right. Any other questions or comments?
What about the psoas muscle? Our yoga teacher,
Yeah, that can be part of it. Yeah, it's kind of involved.
it's a big one, isn't it?
Mm-hmm.
The psoas? Doesn't it help with the pelvic floor?
It has a role for sure. Yeah, yeah. So all of these muscles have to work together in order to be effective, and they have to be strong enough. So yeah, you can have weakness, too much weakness in one area and strength in the other. I know I have trouble with my piriformis and my hip and certain things. Anything else? Wow, okay. Well, I thank you very much for allowing me to come and speak. And I wanted to just mention something to leave you with is that if you invest in your pelvic floor, it will yield dividends. So I developed a little acronym to help you remember this. So, and this information is like the best ATM in the world. So best is for breathe. We want to breathe fully. Okay. A is for address. Please address any symptoms you have. T is to talk about this with the women in your life, including teens. One study showed that teens who experience dysmenorrhea or painful periods, it's a predictor of them going on to have pelvic floor issues as adults. Okay. So important to address it. Move your body and your bowels. And I just wanted to mention two upcoming events I have. On International Women's Day, I'm offering a Yoga for Pelvic Wellness workshop. So it will be an overview of pelvic health for women, as well as yoga we can use to address these common issues. And it's accessible. It's an accessible class to people at any level, even if you've never done yoga before. I also have a free class, demo class coming up next Thursday, February 6th. And it is a class for healthcare and wellness professionals to help them see and experience firsthand how yoga can help the pelvic floor. So if you're interested, please visit my website. There's registration information for both of these upcoming classes. And I'd be pleased to talk to anyone after who maybe wants to discuss a more personal issue off of video.
Thank you, Kathleen.
Yes.
Great.